Deferring a Gillette patient's medical interventions, even during this pandemic, simply isn't an option. Our patients require medically necessary services such as rehabilitation therapies. Delaying physical, occupational, and speech therapy could negatively affect their medical outcomes. Gillette's history of innovation lays the foundation for decisions to find solutions. For more than 120 years, Gillette has been finding ways to improve children's lives when other providers would have given up. In March, in-person rehabilitation visits dropped to less than a quarter of normal. Our leadership team knew that limiting rehabilitation to our kids would negatively impact their lives. They asked, how can we get rehab to our kids, and how can we make this happen now? The answer was in virtual care. Virtual medicine isn't new to Gillette. However, in general, the session was a patient to a provider. Reasons included intake, diagnosis, or continued well checks. Replacing an in-person therapy session was new territory.
We rolled out virtual therapy in waves because we were still in the beginning of the pandemic. This was in March and April, so we were taking things cautiously as we were moving through this whole new world of virtual care.
Teams quickly came together and took a methodical, multidisciplinary approach. Specialists reviewed government practice, payer guidelines, and professional ethics standards to align with established practices. A pilot program tested viability. Gillette also quickly developed clinical resources and protocols and wrote a master training manual. Training began for more than 70 team members. We held virtual training sessions weekly until the entire team had been formally trained. This happened in less than a month.
A lot of these families have high goals for their kids, and then all of a sudden the pandemic hit and therapy stopped. And that, I think, was very scary for a lot of parents because they want the best for their children, and all of a sudden they felt lost. And having us be able to reach out virtually, we were able to provide them another avenue to continue with that skilled care.
We were kind of nervous about how it was going to work out, but I do believe that virtual physical therapy has really helped us as a family grow in improving his skills and building his confidence.
We've actually learned a lot from the virtual.
I've noticed that it kind of keeps us accountable as parents to be able to utilize the skills that we have without anyone being here, instead of just that 1 week in clinic and he feels like that's the only time he has to work hard. We've been able to incorporate in our everyday life with the things that we have.
I think it's been a fantastic avenue for therapy to be able to see the families and the child in their home setting. I can easily demonstrate in clinic with my perfect clinic setup, but the home setup is different for every single person. And now I get to see what they're actually doing at the home. I'm seeing them do it. I'm helping them problem solve.
Go, go. Yes, up, all the way.
And that's been so exciting, watching these kids become more independent, because I'm helping teach not only the kids, but the parents how to work with each other.
Since the inaugural visit, the Gillette Rehabilitation Therapies Department has provided more than 4,500 virtual care visits to children with complex care needs.
So virtual care will never fully replace in person, but it's a great avenue right now to still get a lot of skilled progress, especially in this pandemic. It's still a great avenue to be able to reach out to families that can't make it in clinic. We can open up more doors and be able to continue to serve our families. And I think that's an amazing part of virtual care.